Welcome, everyone, to this month's LinkedIn Live. What's your heart telling you? My guest today is Dr. Jayne Morgan, who is a cardiologist. She's also the Vice President of Medical Affairs for Hello Heart, and she's also a frequent on-air medical expert. Dr. Morgan, it is so nice to have you as a guest. So thank you so much for joining us.
Thank you, Laura, for having me. I look forward to it.
So as we always do at the outset of these LinkedIn Lives, please share where you're coming from. I am in San Francisco. Dr. Morgan, where are you right now?
I am actually in New York, but I live in Atlanta, but I am in New York right now for this working.
Well, lots is happening in New York, especially if you're in New York City. So thanks so much for being with us.
Thank
So
you.
as you all know, February is not only Black History Month, but it is also American Heart Health Month. And many of you also know that as a nominee, a so-called Woman of Impact nominee with the American Heart Association, on February 7th, I, along with nominees across the country, are raising awareness and also raising funds to support women's heart health. And Dr. Morgan, I know that this is something that is near and dear to your heart. This is exactly what Hello Heart is focused on, which is all about women's heart health. Why don't we start really quickly with talking a little bit about your story? And one of the things that you shared is the fact that as a Black female cardiologist, when you came into this, only 0.5% of all cardiologists were Black women. Now it has doubled to 1%, but you
less than 1%, and it is
less than 1%.
5, so 0.03 something or 0.04 something.
That is
Some
unbelievable.
number that a percentage that you can just count on your hand the actual numbers.
Unreal. Well, thank you for representing that, being a strong representative of that. So tell us a little bit about your story and why you decided to pursue becoming a cardiologist, and then perhaps why you decided to focus more specifically on women's heart health.
I was interested in medicine because I had so many physicians, I think, that lived in my neighborhood growing up. I had a family practitioner on one side of us, a dermatologist lived on the other side. On the other side of him was an orthopedic surgeon. Across the street from him was an orthopedic surgeon. Down the street was a dentist. So we're surrounded by all of these professionals. So I really grew up, and I was in a Black neighborhood, and I grew up really understanding that there were many Black people who were physicians. So I was not sort of an outlier in that. However, they were still all men, and their wives are not in medicine. And so I really still sort of thought it was something that men did, believe it or not, and women were nurses. However, my best friend lived across the street. Her father was the orthopedic surgeon. We would play downstairs. I would always sneak into his office and get his textbooks just to look at the weird, gross photos.
I love that.
It would freak me out, and we would put them back, and we'd all run out of the office. And then the next time, so it was sort of a little game to find who could find the most disgusting picture in his medical books. But I started to get a love really of science and medicine, and then I started reading the text of what this was. So I actually went to medical school to be an orthopedic surgeon because those are my role models. I thought that's what doctors did. So I learned about cardiology later, even after I had my medical degree, and I was doing rotations at George Washington University, and rotated through the CCU, the Cardiac Critical Care Unit, and just fell in love with cardiology. So it's just a matter of kind of growing and expanding your environment and your knowledge and growing in your field. And the more you grew, the bigger was your world, and you started learning about other things. So I did not go to medical school to become a cardiologist. I went to medical school to be an orthopedic surgeon. So I'm far away from my original intention, but I found my true purpose.
That is amazing. And one of the things that I think is really interesting about your story, and thank you so much for sharing that, is how much, whether we like it or not, we become our environment. So you happen to be in an environment, that a neighborhood where you were surrounded by others who were physicians. Granted, they were men, but nonetheless, they were in.
They were all Black men, so all Black physicians. So it was normalized for me, but not women.
Right. And so then you kind of broke that barrier. So one of the things that I thought was really interesting in a recent interview, you shared about how, well, number one, we all know that the number one killer for all Americans is heart disease.
Right.
And then more specifically for women, it is also the number one killer for women. We're going to,
Laura, actually, you and I know that, but data shows that only 44% of Americans are aware of that. So we are still working hard to push that message forward that it's not breast cancer, not that we should ignore breast cancer, not that we should ignore ovarian cancer. We certainly want to continue to support research and funding for these types of chronic and oftentimes fatal disease processes. But the fact of the matter is, it's not the number one thing that's killing women. And not only is it not number one, breast cancer comes in at number 7 when we look at the reasons women die. And in fact, if you add breast cancer and all of the other cancers in the world together, cardiology, heart disease is still number 1 of all the cancers added. And yet what happens? We think of heart disease as a disease of men. We think of breast cancer for women, heart disease for men. Meanwhile, we're just dying steadily.
And one of the things that I find is so shocking, and this is something that I learned as a Woman of Impact nominee, is the fact that 4% of all health research goes specifically toward women. And out of that, half of that goes toward specifically cancer. And again, not to say that that's bad, but really looking at the statistics to really understand that, in fact, maybe we need to be redirecting our research to really address what's really happening. So
you know what, Laura, not only we probably should not be redirecting it. That's only 4%. That 4%, we need more to do some other things. We shouldn't take this 4% and have to keep slicing it up. We're 51% of the population. Let's not settle for this 4% and figure out how we're going to slice this pie of 4%. Let's expand the pie.
So such an important point that you made. Absolutely. Why are we putting 96% of all funding when we need to be doing gender specific, specifically for women kinds of studies? So we have Maha Johnson coming in from the University of California in Southern California. Thank you, Maha, for joining us. I want to encourage our listeners to share any comments as we go through this. Please pose your questions to Dr. Morgan. So Dr. Morgan, I want to go back to this whole notion about how we become our environment. As much as we would like to think that we each have individual agency, and of course we do, but you describe how heart disease is a self-inflicted wound. And perhaps we might want to expand that to say it's a community inflicted or a societal inflicted wound in terms of the systems that we have in place. So for example, you talk about the food that we have that's available. You talk about food deserts. You talk about the food chain that we have in place. So what are ask the question, what can be done about this? Because obviously this environment that we've collectively created is really the driving force behind the fact that heart disease continues to be the number one killer. What can be done about this in your view?
Yeah, America is a country of convenience, right? We continue to develop things that are more convenient, that are more digitally accessible. And what does that mean? We move more, we move less while other things do things in our place. We used to just move more with our, what we call activities of daily living. Just the movement that occurred to be able to live every day, the things that we needed to do, like walking or even getting up and crossing the room or any of those kinds of things. We don't necessarily have to do those anymore. We really don't even have to leave our bedrooms to work. We don't have to even expend energy to put on clothes if we don't want to, because we're all working digitally. But all of that is energy expenditure. And so in many ways, we are a victim of our successes as well. And the food industry has also been a part of that. And I don't necessarily think intentionally, but also trying to create quick meals, fast meals for the executive on the go, for the parent on the go, for the mom on the go. And in doing so, has created an entire industry of quick, accessible, inexpensive foods that are incredibly unhealthy, but they fit that need of people trying to keep moving. But it also fits the need of a socioeconomic demographic where you're able to eat and stay on budget when resources are limited. And we see now that it really has been part of the driver of this heart disease. Now, let's make no mistake, heart disease has been the number one killer of Americans for a century. So this is not all about processed foods. However, our food chain has certainly contributed to it. We're not getting better.
Yeah, it's really ironic because in 1973, during the Nixon administration, this is when Nixon, tapped his Secretary of Agriculture, and he said, we need to make sure that Americans are not putting too much of their household income toward food. We need to make it available. We need to make it inexpensive. And this is when the subsidies started. And this is really a huge driver in what has become inexpensive, but incredibly unhealthy food supply.
But incredibly tasty and incredible textures that feel great on the tongue, and so many empty calories that you're hungry soon after and you crave more and you have to eat more and continue to feed your body. These empty calories, it's really the texture, the high levels of sugars. Artificial sugars are 8 to 9 times sweeter than natural sugar. So it is addictive. You get a sugar high, you feel good, you're in a good mood, feels good on your tongue, tastes great. Imagine and it doesn't even cost you that much, right?
And so when Lay's potato chips says you can't eat just one, exactly. They mean that. It is literally, they're creating these addictive substances where you literally cannot have one. And I heard it described as, you eat something healthy like an apple and it's pleasant, but you eat something like a highly processed chocolate chip cookie and it's like insanely good, where you literally cannot have just one bite.
And it's so addictive until, if you're trying to wean yourself from it, you say, okay, I'm not going to have it. I'm hungry right now. This is where I usually reach for that cake or the chips. I'm going to eat that apple. And what happens time and time again, people report, they'll eat the apple and they'll wait, and then they still go and have the cake. So that craving is not satisfied. They do what they're supposed to do, but they can't get rid of it. And so then they have now they've had an apple and the cake.
Right. So
what you have to do is try to keep it out of your house.
Right.
Until you can start to have those cravings abate. And like anything, it takes time. You've got to retrain your body and retrain your taste buds, retrain your brain. If you still have it in the house, even though you now also have fresh fruits and vegetables, and you reach for those fresh fruits and vegetables first, just like you're supposed to, but then you find yourself doubling back to go back to get what you wanted, then you realize you're in that early phase. So you got to just keep it out of reach.
Yeah. Yeah, I often talk about this idea that instead of trying to master our motivation, which is actually a very limited resource, let's master our environment. So the more you can really create an environment that makes it easy to make the healthy choice, the more likely you are to succeed.
Right.
So let's talk a little bit about specifically women's heart health. And, as a Woman of Impact nominee, the story that I share a lot is the story of my mom, who back in 2019, she collapsed on the tennis court at age 79. The EMTs were called in, and my mom, as I think a lot of women do, she said, "Oh, I'm fine." And so the EMTs left her
Okay.
And her friends, her tennis friends, could clearly see that my mom was not fine. And so she brought my mom into the emergency room. Then, even though she was brought in to see a triage nurse, she was made to wait in the lobby for over 2 hours. So the good news is that my mom miraculously made a near full recovery, despite the fact that she had a stroke and was not tended to for nearly 3 hours after the incident. But this is a story that we hear over and over again about how women are left behind, they are undertreated, they are under-researched, as we just spoke about. So what do you see, and what can we do?
That's exactly what we see. The minimization of women's symptoms, the lack of understanding, the lack of empathy, the lack of resources, the lack of training, the lack of. And women ourselves, what it is part of our culture, shall I say, our lexicon, that we are to suffer. There is some degree of suffering that women tolerate. And, if you see on social media, people make fun of it because that's part of the culture. So they say things like, my husband has a cold today, and I'm sure he's comparing it to me being in labor and birthing 3 children. So, we make jokes of, we suffer. Men are not expected to suffer. And even if they have a little cold, they think it's the same as being in labor. And there are lots of little things like that. But that's because our society caters to men, and they are expected to feel good and to feel healthy. And women are expected to sort of suck it up. And that nurturing, put others first. You're always last. You can keep going. And that's what you see in your mother. And that's what you see in many women. Additionally, the health system doesn't help you because we are also not trained to focus on women. We are not trained to listen to what women are saying and listen to what they're not saying, what they're not telling you. That's an incredible part, that nuance of the physician to bring in information without it being told to you, to be able to observe and to understand the culture. And that's why cultural congruence is actually very important. As we started, I am less than 1% of the population of cardiologists, a Black female cardiologist. Cultural congruence is important because your patients come to you, and sometimes it's not what they're saying, it's what they're not saying. And as part of the culture, you will understand what's not being said. The follow-up questions you probably need to ask, I've seen this before. This is like my grandmom. This is my dad. This is my neighbor. I know what this is. And without that, oftentimes those subtle things that either are not brought up or are brought up but not really understood or minimized actually are brought into the forefront if you have a physician that has cultural congruence and is actually giving a lot of credence to the patient in front of them. And that goes for women as well, especially if you're seeing male physicians. And what do we find out in these surveys time and time again? Women have better outcomes if they're seen by female physicians. Wow. What else do we know? Black people have better outcomes when they're seen by Black physicians. What that tells you is not that white males don't care. It's the cultural congruence, it's the communication. Women may feel more intimidated when they're talking to a man. There may be things they're embarrassed about, they don't really want to bring up. Blacks may have the same thing, may not want to be seen in a certain way, and so keep things to themselves. So that level, and as a physician, you may not know what to ask. Not that you are intentionally trying to be a poor physician, you literally just don't know what to ask. This is not a part of your culture, and you haven't had the training. Interestingly, we also see that not only do women have better outcomes when they're seen by female physicians, but men also have better outcomes.
Oh my goodness, right?
That's right.
That is amazing.
Well, somebody's listening. Right?
I mean, it's amazing, when back to this story with my mom, she was like, well, maybe she says, yeah, I did tell the EMTs that I was fine, but what if they had then at that moment turned to my friends and asked them,
Right.
is she fine? They could, and kind of in her,
Or they could have made an assessment to say, we
yeah,
don't think you're fine. We'd like to take you to the hospital.
that's right.
Instead
That's
of
right.
saying, fine. Yeah, she's fine. Let's go.
Yep. And I love this piece about the importance of cultural congruence, because there's a heightened sensitivity
Right.
to what perhaps is not being said because of the
Right.
shared experience. That is so powerful.
Mhm.
And I think that really ties to the importance of the research
Right.
around even the doctor-patient relationship. Interestingly enough, something that my father as a physician researched for years about the importance of that piece in the puzzle. So
Right.
let's talk more about what we can do. Let's start first with women as well as people of color. What can be done to self-advocate? And I know there's a trick that you often talk about.
There is, it's not a trick. It's how do you speak the language of the system, right? So it's a little bit of gaming the system. So you're in this big health system. Everybody has all these degrees and all this knowledge. And, you've been watching Laura's podcast and listening to Dr. Morgan. So you come in to say, I heard this podcast and nobody's listening to you. I'm pretty sure I'm sick and I'm supposed to be advocating, and everybody's telling you you're fine and you're going to be discharged. And, the reason that this is important, even though we're making a little bit light of it, is that a woman's symptoms of a heart attack might be different from those of a man. And so your symptoms might be more subtle, maybe just something like fatigue or feeling run down or back pain or pain in your right arm. And you may be getting dismissed by your physician or the emergency room. And so it's hard to advocate for yourself. I too have been a patient in a system in which I am a part of. And when you are not feeling well, it is hard to advocate for yourself, even if you think the physician is not doing the right thing or is not doing all of the things. You even second guess whether you should even bring it up. Do you even have the energy to argue because you don't feel great? So here's what you do. Ask the doctor to get an EKG. Now you're speaking our language. Don't advocate for yourself. Don't say, hey, I was listening to this podcast. I read this thing. Here's a paper. Why don't you read it and come back and then tell me, it's hard. And bring a friend with you. Your friend can advocate for you too. Let that friend be the pushy, pain in the butt person in the emergency room on your behalf. But the other thing you can do is ask for an EKG. That cannot be turned away. An EKG then gives a determination of something that perhaps the physician or the health system may not have been thinking about or may have been more willing to brush under the rug. Just ask for the EKG. Even if you're feeling well, this is a tip for just your annual physical exam. Women do not get EKGs at our annual physical exam. Why? Because women's health is always focused on reproduction, right? It's focused on our breasts, our ovaries, our uterus. We get a mammogram, we get a pap smear. These are all very important. But for some reason, somehow in medicine, people have forgotten that women have hearts and brains and lungs and kidneys and arms and bones. Men always get EKGs as part of their physical exam. Women do not. We go to our OBGYN and get our reproductive physical. Maybe we also see our primary care physician, but it's important, even if you're feeling well, to ask for that EKG because you want to have it as a baseline in your medical record. What a normal EKG looks like for you, such that if you ever do need some type of cardiac care, we have a basis by which to look back and compare it. Men have that data on their records. Women have our pap smear results and our mammogram results.
I'm thinking about what you're saying, Dr. Morgan, and I had an EKG about 5 years ago because I was, we were in full transparency, we were going through IVF. And so this is for reproductive reasons. They were like, well, we need to have you do an EKG to make sure that your heart can sustain a pregnancy.
That's right. So this is part of the
It just being good practice for my health, right? Exactly. We have a comment here from Maha. We feel that we, and Alana, I wonder if you can share, we need to tolerate more pain, especially OBGYN are mostly men and have no clue what having a baby entitles. Also, we are too guilty to even ask our spouse or others to take care of our kids, so that I can say we want a break, go for a walk, or go to a yoga class. So we are almost always very stressed. And I know that this is something that you speak about, Dr. Morgan.
Maha, that is such a good point. And I want you to follow me at Dr. Jayne Morgan, DrJayne on Instagram or LinkedIn or whatever, wherever, I do a lot of social media, but especially I talk about this on Instagram because we now have publications. The New York Times actually just put out a good publication about the difference in exercise that women get, especially between the ages of 35 and 45 and 50. Men get more exercise by an hour a day than women because women have more outside responsibilities, household responsibilities. And even when the couple states, oh, we share our household responsibilities equitably, when we take a closer look at it, men tend to have the responsibilities that are independent, that they drive, and that they can schedule, like mowing the lawn or doing household repairs. So then they can still exercise and manage all of their outside activities because they schedule that based on their free time. Women have more of the responsibilities that are based on other people's schedules, trying to get dinner on the table, trying to get the homework done, taking care of the children, which means constant interruptions when you're trying to be on the treadmill. So what that means is a lifelong of less exercise and less mobility. And so women, even though we live longer than men by 6 years, we spend a much greater period of our lives in poorer health.
Oh, wow.
That is because we don't get the opportunities to move as much because of our culture. And as women are listening and men are listening or whoever, I am not saying women should not take care of the house. Women should abandon their children. I'm not saying any of those things. I'm giving you food for thought. We absolutely should take care of children, men too. We should take care of our homes. We should prepare healthy meals. That's part of living and responsibility. But I'm also giving you food for thought as to what you need to do to manage it, to also put yourself first as well. Loving yourself enables you to take better care of others if you've taken good care of yourself. I get this question a lot. I'm not saying, be at the spa all day and get your nails done and your kids are at home dirty and you don't send them to school and it's all about you and how you're dressing and you're wearing the latest styles. And, I'm not saying any of that. So I'm not being extreme. I'm only saying try to exercise for 30 minutes a day. That's what I'm trying to say. Figure out
how you men out there support the women in your life in prioritizing their self-care. We've got
Hello Heart. We are focused on that with women because Hello Heart is a mobile health device that monitors your blood pressure. Blood pressure drives heart disease in women. It drives heart disease during perimenopause and menopause. It drives heart disease during pregnancy. All of this is related to women and our hearts. That's why there's maternal mortality. That's why if you have these pregnancy complications, you have a 2 to 3-fold higher risk of heart disease. That's why in perimenopause, our risk of heart disease increases. So we've got to also manage our blood pressures and understand the importance of that and monitor and manage it at home such that we are giving the physicians the information and not waiting for us to go and see the doctor. We find out our blood pressure is high. We don't know how long it's been high. Okay. Right. So now we have the tools where we're in the driver's seat.
Yep.
And can provide that information.
So we have, believe it or not, we are at almost at our finish point.
All
We
right,
have about
great.
30 seconds left. It goes by so fast. But one quick question that I want to make sure that we address here: will insurance cover an EKG?
Yes.
Okay. Okay, good to know. And Rachel, thank you for asking that question. Dr. Morgan, before we go, can you give us just one final takeaway? If there's anything that people should leave with, what is that one final takeaway that listeners should know?
Please remember that heart disease is 80% preventable in this country. That's why I often say it's a self-inflicted wound. There's only about 20% of heart disease that's actually genetic or familial. The rest is all based on our lifestyle, our behaviors, our foods, our exercise or lack thereof, whether we're taking our medications. We've been diagnosed with blood pressure. We don't actually take the medicines. We've been diagnosed with diabetes. We don't actually take the medications. So it's all 80% self-inflicted. So think about how you can take charge of that 80% that you can actually control. Quit smoking cigarettes. Try to get out and move more. Try to eat fresh fruits and vegetables if you can. All of those kinds of things. I want people to remember, if you don't remember anything else, that heart disease in the United States, by and large, is preventable for most people. And what do you need to do? Take small steps to start to prevent it. You don't have to, you don't have to eat the whole apple. And just start with just one little thing and just incrementally move the needle.
So, Dr. Morgan, I want to thank you so much for the powerful voice that you are bringing to this unbelievably important issue and too often overlooked. So for our listeners and for anybody who is listening to the recording of this, you can follow Dr. Jayne Morgan at Dr. Jayne Morgan, and you're active.
My first name, so it's Jayne.
Thank you for that. And Dr. Jayne Morgan is also with Hello Heart, so I encourage you all to check that out. Our next link
on Instagram, and Hello Heart on LinkedIn.
Our next LinkedIn Live, our guest will be Allison Levine on March 19th. She's the legendary mountaineer, polar explorer, and leadership expert. So with that, see you all next month. And Dr. Morgan, thank you so much.
It's a pleasure. Sounds like your next guest gets a lot of good exercise.
Yes. Thank you all.